Bum bum ba ba da ba da da. Predators.
Predators. It's good.
Yeah.
So what's today's topic?
Medical bills.
Ooh.
Stuff
Piling up, folks.
Yeah. So let's talk about United States healthcare because it's ridiculous in how much it costs compared to other nations.
I think it's pretty good.
Oh, yeah? Really?
No.
I don't understand how it's so much. And if you don't have insurance, how are you supposed to pay it? So, in general, if you're going to, like, ride an ambulance and go to the hospital and they're going to do some scans or something, like, what's the minimum there? Like $5,000? $7,000? $10,000?
Oh, Jesus. Oh, like what it really costs or what it should cost?
I'm saying, like, what they try to charge you.
Oh, yeah. It's like $5,000 to $7,000 probably. I would almost guess 10 for some reason. I couldn't tell you the reason, but I feel like they're like, it could be 10 if we, Yeah,
there's a ridiculous... So there's so... This is like an intricate topic.
Where are... Yeah, well, this is a whole episode at one point we keep avoiding. But where is the... Let's say it's $10,000. Where's the $10,000? Because I could Uber you there in an Uber X. Let's get them the nice Uber. And let's get them there.
Bucks.
And let's rent a doctor for half an hour to drive with them.
Yeah, if you could rent... actually, like, be like, Doc, I just need your time.
Listen, what's your hourly rate?
Time.
You make $100 an hour? I just need you for like 20 minutes. Boom. So I put a doctor into an Uber X, and then it's an Uber X with some really nice stuff, and that ride is still not going to total like $10,000 for the ambulance and all that crap.
Break down like a simple bill. It's like ambulance ride, you got the room, you got all the nurses, you got the medication, whatever shots they give you, whatever machines they wheel in, the doctors that come and look at you, the doctors that come in and don't really look at you, but they're in there, and then the scans and the testing and the blood, all that crap, IVs.
The needles? Phlebotomy?
Yeah, all that stuff. Probably like 10 times the cost of what it actually is.
Okay.
And then it gets put in a bill, which you don't see, you don't know, you might not even be responsive. So you can't even say, no, I don't want this. And then they're going to put it all together and charge you over probably months, even years. They might even be like, oh, wait a second. Like one of my recent bills from over a year ago that they go, oh, you still owe us $500. I said, what? A year later? And they go, yeah, we can look back at our records up to 2 years and charge you. It's like... You gotta be kidding me.
Did they do that to you?
Yeah, this is like a week ago for my son's birth, which my son is almost 1.5. And
That's wild. You just got a bill for that? Dude, I hope healthcare industry gets effed and they all go, oh, dude, I would wish terrible diseases on them, except that they have access to healthcare. That's the damn shame of it.
So if I didn't have insurance, let's use my son's birth as an example. The bill would be somewhere between $50,000 and $70,000. Yep.
What?
Yep.
Now, keep in mind, if you're actually uninsured, do you know they don't charge you that?
Exactly.
That's the number they would charge the insurance company for someone who doesn't have insurance.
Yeah, or somebody who didn't know to respond to say, no, I'm not paying that. They might even just say, like, okay, I'll pay that slowly over time all my life. And that's for like a 3-day visit, a 3-day stay. So, A, you have no idea what you were really billed for. B, you don't even know who's on the bill. You don't know what it's for. And then even when you try to pay it off in full, when you say, is this the full amount? They go, yeah, sure. And then you're like, what am I paying for? What am I? What? No one knows.
No one knows what anything costs. If I asked any doctor, "What's an MRI in my leg cost?"
Give me an aspirin.
Anywhere from $20 to I don't know $10,000. It's in there. Excuse me. There's no fees. There's no rates for any of this stuff. It's just the Wild West. They're charging whatever the hell they want because there's 2 companies making more than everyone. We're not going to get into it, but it's the medical people, the doctors and things. That's why doctors are one of the highest paid professions. Not that they shouldn't be, but the insurance companies to cover all these things and malpractice suits and all that. So you have 3 players here. What is it? Insurance companies and everything else, the middlemen sort of. The doctors, the doctors, the hospitals, the medical staff, and the people at home. And it's an arms race between the doctors and the medical staff and the insurance companies because they're all trying to win. And they can raise their prices as much as they want. They can raise their premiums, their numbers, everything. Because that third player, the individual, is fucked.
Saddled with it. So
The whole thing.
how do you avoid getting saddled with that?
Well, you don't ride a dirt bike.
Yeah. You don't get
not.
sick. You don't get injured. You don't get accidents.
Yeah, you don't have an accident. Don't get sick. Don't have any health problems whatsoever.
So I guess the general part of it is live in a bubble or live healthy. Be aware. Be defensive. Don't do anything stupid like riding a dirt bike. Don't know how.
Although everyone has to ride a dirt bike the first time.
When they're a kid, on their parents' insurance.
So now it comes back to insurance. That's interesting.
Yeah. So
that's interesting.
If you don't have insurance, so you get the bill, like the first thing is you talk to the hospital and then you don't pay it. And then you make them negotiate down. I know I had a $7,000 bill earlier on that I shouldn't have paid. I found out if you wait 2 or 3 months and it goes to quote unquote collections, because the hospitals have their own quote unquote collections agency, which is bullshit. You wait till it goes to them, they'll give you like 20% off. You just be like, can I get that 20% off? They'd be like, over $1,000? Yeah, sure. Let's take 20%.
So here's an interesting foible.
Yeah.
I was injured on a dirt bike. My leg was gashed. Had to go to the ER.
Did you pay it?
Not
yet.
No.
Say not yet.
Not yet. I sent them $50. The bill was for $500, and I was like, that's a lot, but whatever. The interesting foible here is I went on the 28th of the month. I still had health insurance.
Oh, yes.
Hold on. They just billed me as uninsured. And the number was within $5. So I said, who cares?
Yeah.
Well, recently I got a new updated bill where they found an extra $300. Now they want $800. And I'm like,
oh, yeah. See that?
I'm like, whoa. Well, guess what? Now I should be like, you should look, I had insurance. Or should I just tell them to try and haggle and find that number first and then figure out what it'd be for insurance?
This part just
because they don't know I had insurance.
Wild. This fucking it's the biggest racket in the world, because what industry says, oh wait a second, a year later and be like, oh, it was $500 more. Like, you can't buy a car and then have them come back and be like, oh, there's an extra payment.
Sir. Ooh, ding 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 ding, you missed a payment.
So
I didn't miss a payment. Oh, I meant you needed an extra payment. That's what I meant. That's what I meant.
It's just money. I mean, it's money. Who cares about money? So my first thing is don't pay it. Wait as long as possible. If you can take a hit to your credit by not paying it, I would take the hit. Because
really?
Yeah.
Oh, I have excellent credit. I have amazing credit. I've for being poor, I have the best credit in the universe.
So quick, use your credit and then let the insurance company and healthcare system just fuck that credit out of existence.
Okay.
And then once they finally come up with a bill that makes sense and has it in itemized,
then go on a plan. Mm-hmm.
Yeah, itemized in total, and you say this is the bulk thing. You can't charge me anymore. I think they told me it was 2 years. They can actually go back. I would wait like 1 year and 364 days and then pay it and be like, there you go, mothers, take that, eat it. And that's yeah. I would negotiate the hell out of it, and then. Also, the medical industry, supposedly they will take small payments. I literally had a conversation on the phone where I said, will you take $1 every month for the rest of my life? And they said, sir. And like,
wait, I will tell you, interestingly enough, I tried to get on a payment plan for this exact injury for $20 a month.
Yeah. And
I filled out all the credit card information. I submitted it. And it said, we will not accept an amount per month less than $50. I'm like, well, then what's the point of this? And I just canceled it. So, no, I have not paid, but I almost did. And for $20 a month, I was gone.
But if you had like a $50,000 surgery and you paid $50 a month for the rest of your life, how long would that take to pay off?
$50,000 and $50. I don't know. No interest on this, assuming?
Yeah. So was that 1,000 weeks?
100 months?
1,000 months. $50? $50,000? 1,000 months?
Yeah, 1,000 months.
How many years is 1,000 months? Let's get a quick.
I have no idea. 1,000 divided by 12.
Like 100 years or something?
That would be awesome. I'd be like, fuck you, hospital.
It would be 83 years.
Perfect.
I
If I
think
make
that'd
it,
be so.
that'd be a good
That's
deal.
another suggestion. Pay it off over time to a ridiculous amount. If it's really is $50,000, 83 years, you'll be paid off.
That's
You'll be free and clear.
in full. That's awesome. That's terrible. I mean, that's really
It's genius, though.
it's pretty good.
Another thing
I
is
like that idea.
avoid ambulances unless it's covered in your city. My city covers ambulances. I got an accident.
That's pretty cool.
It's part of my property tax. So another thing is if you're not local to where you are, pretty much decline it if you can. It sounds awful.
Right.
If you're not in a serious
that
injury,
makes sense.
and if they are like trying to help you or like hook you up to a machine or something, to say like no, thank you. I heard that if they actually do a procedure, like they get you in the ambulance and do anything, yeah, they'll still bill you for it, even if they put like a Band-Aid on. So like an hour's worth of ambulance time or something is like ridiculous.
Ambulance labor. Band-Aid.
The ambulance is like tired. It's exhausted. It had a long day.
Yes, it is.
Needs a rest.
Another funny thing is that if you don't have health insurance and you get something like poison ivy on your balls, you know what you got to do?
Tofaftin, Tinactin.
Tough it out. Spray your balls with some weird adhesive, like the open wounds. Just spray them. Who cares?
What kind of whitish powder or something?
No, I did use talcum, not talcum. Cornstarch. Cornstarch burning. So there's a spray that's made of the same stuff that's in.
You mean like cornstarch? Like when you make Chinese food, you like put it in cornstarch to like.
Yeah, I dipped my balls in cornstarch to stop the weeping. Well, because it was so bad that they were weeping, and I was
how you had the mop motion with your hands. Like you're just like.
Oh, that wasn't a mop motion. That was me holding the shaft. I was dipping down. The
chocolate strawberries.
My testicles were weeping into my clothing, and just like, those wet open wounds. So to cauterize them, I would spray them.
Yeah, because it was burning and itching and oozing.
Yes. So to stop it, there's like the same thing that's in calamine lotion, the stuff that you would put on there to kind of dry it up. It's an aerosol version, and I would spray my balls with it, and the pain was a 9.5.
Avoid a hospital
to any doctors.
Yeah.
I was doing it. The pain is a 9.5 out of 10. I would almost pass out every time I did it, and just shake for a few minutes. And I would always do it in front of the mirror because where else are you going to spray the balls?
How are they doing now?
Better, but not perfect. Like they're still sensitive. This is like a week and a half after the poison. Wait, so I stopped doing that, and when we got back home, because I was on vacation when this happened, I decided I should take a steroid, but I can't go to a doctor and get one prescribed for me. Because that would cost too much.
Don't do this at home, but
no, you can do this, folks. Trust me.
Nick is a prime example.
A steroid will clear up your poison sumac, your poison oak, and you're dealing with a leg wound.
And you search this online, I bet.
No, a friend of ours had for their dog a Great Dane that weighs over 150 pounds.
The dog had poison ivy on its nuts.
Well, no, it had issues where it needed something cleared up. It was prescribed prednisone, a steroid. Well, I was taking dog prednisone for about a week straight, and
it worked.
Cleared everything up. Yeah, cleared up. The dog prednisone works just as good as the human one, and you know what? I didn't have to pay a doctor, anyone.
Don't do this.
Everything's happy. Anyway, so that's what healthcare does to you. I'm here not paying the bill for a medical wound. I'm here taking dog steroids, and I'm spraying my nuts with some kind of aerosol. And that's healthcare in America, baby. I love it.
Yeah. God forbid you shouldn't have a job for a period of time and not be able to pay the $1,000 a month it takes.
Or if your job doesn't, doesn't provide it.
Oh my goodness, our system.
So anyway,
it's
real bad.
The key here is you're fucked.
The key here is my cousin. He moved to London, right?
Mm-hmm.
He was recently just diagnosed with cancer. Leukemia, like some kind of like rapid thing, whatever.
Yeah. You try to become a citizen of that country.
It's not. He already is because he's been over there for like 2.5 years.
Yep, nationalized healthcare.
Dude, the day that he was found to have it, they already had a plan in place. He's doing chemo. He has like a 6-month plan for chemo off, this on, off for 6 weeks, do this for 2 weeks. Like it's a crazy regimen. I'm like, he's going to go broke. Michael's screwed. And they're like, no, he's going to be okay. And I was like, excuse me? I was like so worried about my cousin. And then for a second, I was like so mad at him. I was like, he's not going to go bankrupt.
Your leg. You're like,
I'm going to go
$800 for the leg.
I'm going to go bankrupt for riding a dirt bike. He gets cancer and he's fine. But like that's
God damn it,
Michael,
Michael!
way to put it. Damn it! But honestly, it makes me think, good thing he's over there, because our country friggin' sucks. If he was here, he'd be screwed. You'd be probably bankrupt for the rest of your life, kind of.
Yeah. To be fair, they probably charge a lot in taxes. I don't know what the difference is, but we'll get into that in another episode.
We will in another episode, but I'm guessing it's already better. Maybe not perfect, obviously. Nothing's perfect.
Yeah, but at least you don't have to worry about it. So that's part of the thing. It's like worrying about this stuff. Don't till it comes time, till the very last moment. And then you're like, either you got it or you don't, and just take the hits.
Just do it. Nike, just do it. You want to jump off of some kind of building to impress a girl? Just do it. You ever jumped off anything really high to impress a girl? I feel like that's a thing.
Not to impress a girl, no.
Boy.
I think we'll end on that. Good night. This is another episode of Predators.
You forgot the beat. Predators.
Boop, 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 boop. Predators.
There you go. Predators.